Hello, this is Alane Freund, licensed marriage and family therapist out in California, here on the Dr. Joe and Alane show. I'm experimenting with names for our new show, Dad. This is my dad, Dr. Joe Freund. He's a retired physician and microbiologist, and he's in Oklahoma. And we've been talking to you and each other about COVID-19 and all things COVID-19. And in this video, I wanted to talk a little bit about what happened to me this week when I saw the news. And what popped up on my screen was the phrase Kawasaki disease related to COVID-19. And our family has a personal connection to Kawasaki disease because my son had Kawasaki disease. Usually it happens in children below the age of 6, and it actually came to our family, I'm going to say about 27 days before my child turned 6. It's a systemic inflammation where the body just goes into overdrive, and it was a horrible experience for all of us, most especially for him. And now we have these children who have some kind of intense inflammatory disease that they think is related to COVID-19. And since we have Dr. Freund here, I thought we should ask you, Dad, tell us a little bit about what's going on, what your concerns are. Should people be worried?
I think so. You know, this started out as something people just had never seen before. It's new. Now, we're not saying that this is Kawasaki disease, but it's Kawasaki-like. It's multiple inflammatory disease, and they thought the pediatric multisystem inflammatory syndrome, I think. And the things that are different are, one, Kawasaki disease generally occurs, in after toddler ages. But they've got children up to 16 and 17 coming now, and they present with unusual symptoms. They've got rashes, red eyes, and no one knew what was going on. And someone was smart enough to figure out some of these children, if not all, had antibodies. We talked about the antibody test.
Right.
That's the way I assume they found out that they had COVID-19. And it comes on sometime afterwards. Well, the things that are alarming is we're now up to 200 cases that have been recognized. I think there's been, the last I heard, 3 deaths. And it's just horrible that they come of that because there is no treatment. There's no treatment for sure yet, even for COVID-19 in adults. So I don't know what they're doing for these children. There's been so few. But anytime you have a child at risk, then it gets everybody's attention. It's worth considering.
Yeah, I just had a chill because it's so profound. I mean, when your child is that ill that they have systemic inflammation and sustained fevers, it's so scary. And what makes me think, what I think about this is what I keep hearing over and over again, that the millennials are the ones who really, they can have COVID-19 and it seems like they don't even care if they get the virus. And so between them being parents and, well, you had some stats too about the millennials. What were the ages of people who were hospitalized?
Well, the CDC put out their morbidity, I forget the name of their report, and from mid-February to mid-March, there were 20% of the hospitalizations were people between 24 and 54. And 20% of those in the hospital were in that age group. And that takes care of.
That's a pretty big percentage.
Half of that's a millennial group, 20 to 30, 7.
Yeah.
But 12% of the people in the ICU were in that age group. And I've said the millennials don't seem to care. Well, these millennials are when young families are having children, 22 to 30, some earlier, some others, but there's no definite timeline. I'd say anyone from 18 to 40 who's having children are at risk for their children to catch this disease. And not only can a millennial catch it, the children can. And we're not even talking about the pediatric multisystem inflammatory syndrome. They're indifferent. They don't even get that syndrome till after it. But I think if millennials start getting sick, they're going to start paying attention.
And if their children are at risk of this terrible disease, it's life-threatening.
That's when I think they'll start wearing masks. If they're not going to wear masks, they ought to go ahead and do what they're going to do and get it over with. This disease is not all different from other pandemic. It's going to run its course. I heard one analogy that flattening the curve supposedly is like squeezing a balloon full of water. You change nothing but the shape. And flattening that curve, in some people's opinion, was to prevent the hospitals from being inundated and overwhelmed like New York. So basically, millennials are going to have the kids, their kids are going to get the pediatric most inflammatory disease, and they don't realize it, but 12% of the ICU beds in the CDC study in 1 month were people below 54, and a lot of them were millennials.
Right.
It's just a shame that society can't accept this, but I've come to believe that the ultimate numbers aren't going to change much. So I think if they're not going to protect the other people, they ought to just go ahead and get it. Some people would catch chicken pox on. The disease is not deadly, except for certain cohorts in the population.
Right, and small percentage.
One of those.
Yeah, unfortunately you are. So because of that, we said this a little bit in another video, but it bears repeating. You and Mom are going to make the decision to continue to protect yourselves, right, Dad?
Yes, I don't go into stores, but occasionally when I do, I wear gloves, I wear a mask, and I carry the at least 65% alcohol in my back pocket. And if I touch anything, I do it right there. It's no big deal. I don't pick up a gas pump without alcohol in it and my gloves. It's not very likely. It's a very low percentage, but if someone with comorbid positions or just older people get it, it's 100% if you're the one. And if your relative or loved one dies, that's 100% experience for you. So no one really knows the outcome of this. It's going to run its course. The quicker we get people semi-immune, the quicker we get towards herd immunity, which probably will require vaccines. But herd immunity does not really kick in until 70 to 95% of the population has the antibodies. Depends on a lot of things, the nature of the virus, the nature of the people, the density of the population, even humidity, even temperature. So all of these things played a role, and still after all these 3 or 4 months, no one really knows much about this disease. They just don't know. The experts are making intelligent, scientifically rated guesses, but we've seen they're
still guesses, right?
We just don't know yet.
Hypotheses, maybe.
Mm-hmm.
I mean, I wanted to repeat again that I heard this first from my Auntie Phyllis, that she wears a mask. Long before COVID-19, she always wore a mask on the airplane because she travels to Asia a lot and she learns from people in Asian countries who often have masks on, but it helps her keep from touching her face. And I found that that's definitely true. And the other thing that I've been doing is I have a lot of work and garden gloves. I mean, I have a small farm. I work outdoors a lot. So I use those gloves and I just wash my gloves every day, and I have several pairs. So it's not like I'm wearing gloves that you would wear in the hospital all the time. So there's lots of different options, but I think it is really important that people who are vulnerable protect themselves. And I think that's your bottom line.
I think you're right. I think you just use common sense. And if you're at risk, avoid the risk locations.
Yeah. And if you have someone in your family or in your quarantine, as they're saying now, your small circle of people that you do expose yourself to and get exposed to, then you might be that person who wants to wear a mask. Because remember what Dr. Joe Friend always says is that we wear a mask to protect our loved ones and to protect people in our community, not to protect ourselves. So you folks, like Mom and Dad, you stay home and be safe. And the rest of us will go out and hopefully we'll wear masks to keep other people's families safe. Thanks so much for being here, Dad. Do you have any closing comments?
Oh, just be safe, use common sense, and stay healthy. Get a lot of sunshine. That vitamin D helps you. And it also is nice to be outdoors and exercise.
Oh, yeah, absolutely. Well, since I'm the mental health professional here, I'm going to say what I'm always telling my clients is you need to sweat every day, exercise, 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 and relieve that stress because that's what your immune system also needs. All right, we'll sign off for now. Thank you so much for joining us.
Good day.